Recently, Governor Henry McMaster signed an executive order that will allocate finite SNAIL rapid antigen tests to all public schools in South Carolina. Currently, DHEC and the South Carolina Department of Education are coordinating allocation and distributions of tests to school districts across our state. The first distribution lot will be based on 10% of district staff and student populations. After this, test distribution will take place on a monthly basis until supplies have been depleted. Future allocations may be adjusted based on usage of kits, school district needs, and historical community information. Finite SNAIL is a rapid antigen test for the SARS-CoV-2 virus, more commonly known as COVID-19 or the coronavirus. These rapid antigen tests are most accurate when administered to symptomatic individuals and can be performed by the parent or student under direct supervision of the school nurse or athletic trainer. Current practice outlined by DHEC in the school setting is to exclude students and staff from school if they experience one of the following symptoms: new or worsening cough, shortness of breath, difficulty breathing, loss of taste or smell, and a fever or a fever of at least 100.4 degrees Fahrenheit or more. These symptoms can be associated with the COVID-19 virus. However, they can also be associated with a number of other communicable illnesses that are commonly seen in school-aged children and adults, such as strep throat, influenza, or the rotavirus. The role of the school nurse is to decrease the spread of all communicable illnesses by school exclusion and recommendations for formal evaluations with a licensed physician or family nurse practitioner. Rapid antigen testing in the school setting reduces our current mitigation strategies to decrease the spread of COVID-19 and other illnesses within the school setting, from which we have currently seen positive results. For testing to occur in our school districts across South Carolina, there are several guidelines and requirements that must be followed. Firstly, parental consent must be obtained for each student prior to test administration. At this time, DHEC is actively creating a uniform parental consent that all districts across the state will be able to use. Secondly, each school district will need a Clinical Laboratory Improvement Amendments Waiver or a CLIA waiver. The South Carolina Department of Education has an umbrella CLIA waiver that covers all districts in the state and will allow testing to begin as soon as kits are received. At this time, the Georgetown County School District has applied for an individual CLIA waiver and are awaiting approval. Finally, it is the responsibility of the school district to ensure that processes and systems are in place before testing begins. These would include, but are not limited to, infection control, providing proper personal protective equipment, documentation for all regulatory requirements, waste disposal, and test result reporting. There are some positive aspects of rapid antigen testing in schools that I would like to share with you. Firstly, testing in schools would add to the many testing sites around our county to ensure that all students and staff having COVID-like symptoms would have access to free COVID testing. As we know, the rapid identification of COVID-19 increases the delivery of early and accurate treatment in symptomatic individuals, thus decreasing the risk of detrimental effects from the infection with the SARS-CoV-2 virus. Early identification also decreases the spread of the virus by quickly identifying positive cases and their contacts in order to isolate or quarantine the virus to prevent illness spread. Please note, however, that individuals infected with the COVID-19 virus are contagious for up to 48 hours before the symptoms begin, and up to 90% of school-age children are completely asymptomatic while infected with the virus. While rapid antigen testing in the school setting can identify symptomatic students and staff who are positive for the coronavirus, it cannot identify those who are asymptomatic but still contagious. Georgetown County School District has ensured that all DHEC guidelines for decreasing the spread of COVID-19 are strictly adhered to by providing face masks, gloves, plexiglass barriers, frequent classroom and school sanitizing, and decreasing cohort numbers by providing means for virtual learning and hybrid class schedules. If in school rapid antigen testing is mandated, our school district has some personal protective equipment available to our school nurses. However, what we have on hand is not adequate in protecting our nurses from becoming infected. The concern regarding inadequate personal protective equipment is rising among our nurses and administration. Nurses caring for and testing persons with probable COVID-19 virus don far more PPE than we can provide at the school district level. Please note the picture to the right of the slide. These medical professions are donned in complete suits covering the back, feet, hands, face, and hair. The masks that they are wearing are test fitted to their faces, ensuring that no virus can penetrate them. And the face shields that they are wearing cover their entire face. We do not have this type of PPE available to our nurses. This increases the risk of infecting our nurses with the COVID-19 virus. Because of this, testing in schools by our school nurses increases the risk for unintentional transmission of the virus. The school nurse comes into close contact with many different students and staff members throughout the day. Without the PPE noted in the picture, our quarantine numbers and positive cases will rise drastically. Along with this, there are several other concerns that we should explore before making the decision to test in schools. Firstly, while the test has good accuracy in detecting the COVID-19 virus, it is not as accurate as testing done in physicians' offices. This could result in the return of a positive COVID-19 case to the classroom unintentionally, which increases the likelihood of classroom and school-wide closures and quarantines. Next, the entire process for the Binax Now rapid antigen testing will cause the school nurse to be unavailable to provide care for other students or staff members for up to 45 minutes. This time includes donning PPE, instruction, testing, test development, reporting, doffing PPE, and discharge instructions for the student and parent. This would require additional nurses and/or staff members to carry on the normal caseload of the school nurse while she is unavailable. It is also required that there is additional space, excluding the isolation room in the nurse's office, for testing to occur. After the test is completed, the room must be completely sanitized and left unoccupied for as long as possible, or 1 hour, whichever is longest. With the extra space needed already, our schools will find it very difficult to provide this area because of current class sizes, room occupancy, and school building sizes. In addition to this, rapid antigen testing in schools may have an adverse effect on our efforts to get our students back to 5 days per week face-to-face instruction due to lack of nursing staff to cover the increase in student population, testing, reporting, contact tracing, medication administration, and other day-to-day nursing responsibilities. After reviewing all aspects of the Binax Now rapid antigen testing in our public schools, we have recommended that our district not introduce this to our schools at this time. Our current strategies, as we discussed earlier, are working. Our county also has many free testing sites in close proximity to our schools that give students and staff access to free testing every day without appointments. Georgetown County School District nurses have been trained and are working around the clock to ensure that our students and staff remain safe while at school by following current DHEC and CDC recommendations and guidelines. I would like to note that we have not experienced any increased positive COVID-19 cases due to in-school contacts. Identification of positive cases occurs rapidly in our county, and those students and staff members are excluded from school, oftentimes before they present with any symptoms. Thank you again for your time and attention during this presentation.